Hello and welcome back to another episode of the Help Is Here podcast brought to you by the Beyond Compulsion Academy. Today I'm with Mary Paulus. We're going to be talking about some not so good porn addiction advice. There's a lot of people out there sharing a lot of porn addiction advice. I sort of went down the route of consuming everything I could on YouTube for like 9 years. And I just kept on going around in circles, relapsing, relapsing, relapsing. Personally, I believe that we have got a solution to this problem, but I think one of the starting places is to start to unlearn some of the stuff which is actually very, very detrimental and is being posed as very helpful and is actually really getting in the way of people overcoming this for good. So, Mary, how you doing? Do you want to start off by sharing sort of your thoughts on this video that you've just watched?
Yeah, well, thanks for letting me know about it. One of my first thoughts is, would you and, I've got 35 years experience working with addiction. So maybe I should go out and perform vasectomies. Hire me to, you know what I'm saying? It's like this person's a urologist, right? So you've been trained to treat, whatever. I mean, maybe they're going to her because they have erectile dysfunction. I don't know how she got into dealing with porn. But the thing is she certainly hasn't been trained in addiction, and yet she's dispensing all this advice that, I mean, there's just a lot of things, but I feel like stick to the physical aspect, stick to what you've been trained in, So I'm certainly not going to go and, treat someone's physical issues with their urological, stuff, right?
Mm,
It doesn't make any sense to start with. So, well, one of the things that she said was, if porn brings you joy, I mean, even just framing it that way is kind of leading people in the wrong direction to start with, to get down to the reality of like, you know, the reality of living with a porn addiction. Don't glamorize it. That I mean,
mm,
the addictive part of the mind is going to use that right there as glamorizing and use it as a reason. Oh, porn brings me joy, right? So but it's kind of like the usual stuff, right? Um, she talks about the consequences, which is useful, to really think about
yeah.
the consequences that are caused by porn addiction. But, she talks about increased mental health problems, depression and anxiety and things like that, which
Mm,
makes sense. But then later in the video, she talks about, treating treating those issues and maybe getting a therapist. She talked about getting antidepressants and now naltrexone, I guess it's called, which is it's a drug that attaches to like the opioid receptors, right? So again, but it's still an addictive drug, So now we're going to treat the anxiety and depression that is caused by the porn addiction with more addictive drugs
mm,
and therapy, back to just, the normal stuff. But, and again, we've talked about it before, and I know you said you're putting out a video soon on therapy, where therapy is dealing with any old issues that may have caused you to be more susceptible to addiction, because you had a difficult childhood or trauma or whatever. That's not going to change neural pathways from that go from compulsive desire to acting on it, right? You got to deal with that very specifically, and that's a whole nother level of training. um, but it came down to the tips, right? Here's your tips.
mm.
Delete all access to pornography, right? And now we're not just going to delete all access, but we're going to have an accountability partner, right? So
Wow.
like as if you can't like unblock. But I think maybe she's selling an app. I don't know. Maybe she's getting
Yeah,
commission.
yeah. That bit's
But
crazy though. There's
yeah,
like an ad. There's an ad at the bottom, like, oh, it's like in the
yeah.
description. It's
Blocker
like,
X.
yeah, yeah.
Blocker X app.
There was
Not
actually
just
some,
that, but
yeah,
premium Blocker X
premium
app. So
blocker
now
X.
you can
Right,
block unlimited, as
right,
if
right.
the other blocker apps you can only,
Mm,
do a certain amount. But oh, and also there's only your accountability partner that can unlock it. And I'm like,
God.
is she getting commission from this Blocker X app?
Well, like I
What's
had a
happening?
look in the comments, and there was actually some people, to be fair, like kind of hating on that a little bit, that aspect
Oh,
of the video.
good.
Like 99% of the comments are like, "Oh my God, this advice is so good, thanks so much." But
Yeah.
like, there were a few comments as well that were like, as if this video is like literally sponsored by a blocker website, by a
Yeah.
urologist who focuses on things
Yeah.
nothing to do with addicting neural pathways, getting sponsored, making a shit ton of money because that video's got like literally over 1 million views, like an insane amount of views. She would have made
Yeah.
so much money from being sponsored by a blocker company. And yet the thing is with blockers is they're what they're like part of the problem. They ain't making it better. It's making
Yeah.
it worse because you're
They're
basically
making it work.
you're
Yeah.
conditioning your brain to believe that you don't have a choice, like you're
Yeah.
powerless, you're helpless. Oh, we need to have some accountability as well. Like you don't need
I can't do
accountability to
it.
teach neural
And I
pathways.
can't go ask my accountability partner to unblock it and it's just so based in helplessness, literally every bit of it. But then she goes on to talk about, okay, so now identify your cues, right? Now we're into the what's causing it. Okay, so now that you identify your cues and now you have the urges, how does your body feel? It's all about how does your body
Mm.
feel. I'm so sick of this inane advice. It's like it's harming people. Come on, man. This is not in your body, other than maybe with porn addiction, you get sexual desire, hard on, whatever. Yeah. But it's just also irrelevant. It's like making a compulsive eaters, someone who's totally obese, making their problem about their stomach and giving them gastric bypass. It makes no sense. The
Mm.
desire comes from the mind, right? So, but then now that now that you've identified your urge feeling, this is where it gets really good. And I don't want to say very specifically what she said because I don't want to, connect it directly to this person. But
Mm.
now you give it a color or a shape.
Color.
And we'll just say we're going to identify your urge as some kind of a colored animal of sorts. I mean,
Jesus
like,
Christ.
really? Is this how much we're going to trivialize addiction? So,
What?
okay, so now you've got, we'll just say the red frog, whatever. Now here comes the red frog. So now she talks about,
Bad.
allow it, let it pass. And she said she's kind of implied that you're going to deal with this for life. And there's some
Mm.
validity to, allow it, identify it, as a red
Mm.
frog or whatever, and you're going to let it pass. But the thing is people don't have the tools for that.
Yeah, yeah,
That's so much easier said than done, that you can't just let it pass. But
yeah.
then but then she decides that, since here's your tool for letting it pass, right? You're going to replace it with walking, talking to a friend, reading, taking a bath, do jumping jacks or push ups. I mean, we're just talking about, again, try not to think about it, replace it with something
Mm.
else, do whatever to try not to think about it. The same lame advice that basically perpetuates addiction, right?
Mary, please let me jump in here. I'm,
Yes, jump
I'm,
in.
I'm begging to jump in with some fire here. So,
Get it.
honestly, the reason I'm like, I know we're both very passionate about this, but for me personally, it's like I literally spent 9 or 10 years, however long it was, watching videos with millions of views, all the comments, like 90% of the comments are like, this is amazing advice. And then I'd relapse. And then I'm thinking, shit, like, what's wrong with me? I'm doing
Yeah,
everything that these people are telling me to do, and yet I'm still relapsing. But let's reframe all this. Imagine we switch it up, right? Because the addicted part of the mind is like a bully. Like the addicted part of the mind is going to keep on trying to get what it wants, bullying you, bullying you, bullying you. And we need to stand up to it directly and deal with it and change those neural pathways. So imagine you're at school, you're getting bullied, and then you're just like, right, I'm gonna try to think of a frog or some shit. It's like that ain't
yeah,
gonna deal with a
yeah,
bully.
yeah.
Like we got to deal with it. You can't just go
Oh,
take a walk, get an accountability partner to deal with getting bullied. You gotta like deal with the bully. To be honest, you gotta
yeah.
fight.
And here, that was the next thing
Oh,
was, now if you give in,
mm,
it's part of the journey. be kind to yourself, right? It's like the same crap.
Yeah.
It's like if you're going to be kind and gentle and compassionate with yourself, then like somehow that's going to help you. No, if you're that way with the addictive part of your mind, it will steamroll you. I've said it a
Yeah.
million times. You can't be kind and gentle with the addictive part of your mind. You're going to be kind and gentle with the bully, oh
Mm.
yeah, it's okay, just hit me, I'm fine.
Mary,
It's like,
Mary,
yeah,
you know,
go.
you know what I want to do right now? I want to go get a
But
remember letter. I'll get my own remember letter. It's dark. I don't mind sharing it. I'll go get it now. I'll read that
yeah,
out, and then we can think of how useful it is to have like blockers in place to deal with this problem. Because
yeah,
I think the thing
go get it.
is, it minimizes it. I'll go get it, but I just think the
Yeah,
problem is it minimizes the reality of this addiction. Like we speak to clients day in, day out who have this serious, serious problem. They're in misery. They're stuck. They don't know how to get
yeah,
out. And they're trying all
yeah,
these things. And it's just making it worse. Because if you block yourself from something, you end up getting into feelings of deprivation, as we talk about. And, you want to do this thing. You feel like you can't do it. You feel pretty terrible. It's awful. So
yeah.
this is how I felt. And, I'll read out a bit of my remember letter here. Remember being stuck, improving, and then back to misery. Round and round and round. Remember taking my pain out on other people. Remember looking down the stairs and thinking, wouldn't it be nice? Remember the loneliness. Remember bumping into people in the street. Remember treating people like disposable objects. Remember never feeling satisfied. Remember calling the Samaritans. Remember the shame. Remember the panic. Remember the self-disgust. Remember the insecurity. Remember your head being a total mess. I could go on and on and on, but the point is,
But maybe you should just
uh,
visualize a red frog.
it's not going to help. It's not going to do it, you know?
I'm so
We got to
sorry.
face that
Go ahead.
reality.
Go ahead.
No, no, no. Honestly, that's all right for now. I think maybe I'll read it out. I can read out more of it another time, perhaps, because I don't want to go on and on and on. But I think the point is that like porn addiction's hard. It's a thing where you got to deal with it directly, and that video is just telling you to run away from it in one way or another, whether it's blockers or it's accountability or it's going for a walk. Everything in that video is just centered around
Yeah,
moving yourself away from the desire. But you got to deal with the desire to change the neural pathways.
yeah, and yeah, it's interesting because the same bullshit advice that she's dispensing is the same stuff that you would hear people telling any other kind of addiction,
Mm,
with any other kind of addiction. The same trivial tips. I hate this word. Oh, here's some tips.
yeah.
It's just like, stop trivializing this. Stay in your damn lane. You know what
Mm,
I mean? It's like if you're a urologist, stick to dealing with the biological physical functions of that part of the
yeah.
anatomy.
Yeah.
Stay in your
Absolutely.
lane. Again, we're not going to go perform vasectomies. It's
Yeah.
or gastric bypass. Let's go perform gastric bypass surgery because those people are dispensing advice on food compulsion as well.
Yeah.
It's really quite it's insane.
It,
So yeah,
it, it
it's
honestly is. And like,
maddening.
I'm
It's
I'm
maddening to
not
me.
I'm not a doctor, I don't have the qualifications that maybe she has, right? She's a doctor, urologist, whatever. She can use that to make a ton of money, whatever. But I think if you do want to maybe read a bit more about the neuroscience and all of this, I'm gonna sort of promote this book a little bit here. I'm not affiliated, I ain't gonna get paid for this at all, but this is a book by a guy called Norman Doidge. Now, this isn't gonna get you to overcome an addiction, but it's a book called The Brain That Changed Itself. And it's really interesting because it's actually backed up by like data, research, neuroscience. It talks about brain maps. Basically, how the brain works is like when you do something and a certain response takes place in the brain, then you form like these brain maps, and it's like neurons connecting together in the brain. And then you want to do that thing again. And so now you've got this brain map. And what happened to us, people who got addicted to porn, is we developed these brain maps at a young age, right? And it's like it wasn't our fault. We got born into a messed up society where we develop these brain maps where we get addicted. So now those brain maps are in place, and to change them, you have to experience the desire, that compulsive desire, think
Yeah.
it through, and not act on it. And that's how you change those brain maps. Now, obviously, that's what I've done for the last like 12 months, and we're seeing it happen
Yeah.
with clients as well. So it's like with that knowledge and that understanding of neuroscience, when you hear all this stuff talking about things that are just focused on getting away from the desire, it's like
Yeah.
that's never ever gonna lead to the freedom that people are actually wishing for. And it's gonna
Yeah.
frustrate people as well because they're gonna try it and then feel like they're the failure when they're not. It's the misinformation which is the problem.
Yeah, you need to very intentionally and very, I mean, I don't really like that word that much, but it is very intentionally, very assertively, change the thinking, identify the thinking, acknowledge the thinking. You can't just like acknowledge it, I'm having an urge, and then, okay, I'm going to go do some jumping jacks. That's not going to change those pathways in the brain. I don't know the book called The Brain That Changes Itself. I don't know what that exactly means, but
Mm.
you got to do that change. If you just are going to float along thinking that you're going to do jumping jacks or go talk to a friend or whatever, or read a book or anything to not think about it and to let it pass, that's not going to happen.
Mm.
It just simply is not going to happen until you take charge and stop letting the addictive part of the brain of the mind drive your car.
Mm.
It's going to drive you into a brick wall. It's like you need to take charge of that. But again, that requires an in-depth education, which is exactly what we provide. We're not going to trivialize this or talk about red frogs and crap like that, and blockers and apps and accountability partners and all this kind of stuff. Give a full-on in-depth education on how you can actually change the neural pathways in your brain so you can
Mm.
get free of it, because
Yeah.
you're not I'm getting real tired of the trivializing of addiction from people that don't understand what they're talking about.
Yeah, yeah, for
Yeah.
sure, for sure. And honestly, like some of the remember letters that we hear, they're bad, aren't they? Like it
Yeah.
ruins people's life, this addiction. It really does. So, I
Just
think
got one last night that came through on the WhatsApp, and I was just like, that's when I messaged you and
mm,
said, this work that we're doing is so critical to the wellness of
mm,
humankind. It's like the suffering that's happening it's really profound. So
yeah,
I'm glad that we can provide this education for people. And,
yeah,
but the thing is they think, oh, doctor, expert, right? Well, stay in your lane, you know,
yeah.
stay in your
Honestly,
lane. We're not going to perform vasectomies.
yeah.
So stay in your lane, man. That's all I can say.
I hope if this podcast does one thing, it can help someone relieve some of those feelings of shame in terms of like, there is something wrong with me. Like, I've been trying and trying and trying. I keep on
Yeah,
relapsing. Like, what is my
yeah,
problem? Because 99% of our clients come to us in that situation. We have like a porn addiction quiz, and like one of the questions is like, have you been trying to do this? And then you keep on like engaging, like you keep relapsing. And it's like 10 out of 10 is the answer to that, like 75+% of the time. And then like most people who actually work with us have been doing the no fap for like 10 plus years minimum. So
yeah,
those guys, they've been trying the wrong thing. And then they start having all these feelings of failure, shame, lack of confidence, lack of self-respect, blah, blah, blah. And they're not even aware that they've formed these brain maps, like they're addicted. They have these neural pathways that have developed. And it's like,
yeah,
not your fault. And actually,
yeah,
those one of the reasons those neural pathways have developed is because you've been trying to control and stop this behavior through the wrong paths. Like
yeah,
blockers, they actually make it worse, not better.
yeah. And she does, start the video with don't this not she's not meaning to shame anybody, and that I understand that, because we're all susceptible to addiction, right? And
Mm.
especially young men getting exposed to porn online. Of course, it's not your fault or whatever, but you can just say, oh, yeah, we're not shaming you. But the thing is until you can understand how the addictive part of the mind will actually use shame and self deprecation against you to get you to engage in the
Mm.
behavior, it requires way more education than, oh, don't feel ashamed. You know,
Yeah.
it's the addictive part of the mind is invested in creating those feelings of shame.
Yeah,
So,
that's a really, really good point. Now, obviously, we talk about these quite a lot on the podcast. For anyone who's not heard of them already, we talk about junky thoughts quite a lot. Basically, any excuse, rationalization, justification to engage in your compulsive behavior. So, any reason that the addictive part of the mind comes up with to basically do this thing which really is destroying your life. And yeah, talking about shame and everything, another thing that we have a lot is these junky thoughts which are based in sort of self-deprecation. So I'll actually read
Yeah,
out a few. I can get these up here because
sure.
we've got them documented. So here's some things I've heard from clients. Maybe I'm just a scumbag. Maybe deep down at my core, I'm just an animal who wants sex more than anything, and that's it. Maybe this is the best I can do. Porn, masturbation, orgasm, and maybe paying people for sex, I guess. Got another one. I'm really fucked up. Another one is I'm full of crap. I can't live up to this. I always self-sabotage when things are good. I'll never get free. So yeah, they're just a few examples of
Yeah, I'm like
specific
basic, like
thoughts.
I'm a
Mm.
failure. I've always failed before.
Yeah.
I know I'll just fail again, which is also future thinking. But the thing is too, is like when you have self-deprecating thoughts,
Mm.
the addictive part of the mind is very tricky with that because it'll just let you beat yourself up and just until you are just this big loser who's circling the drain. Now you feel so horrible about yourself. Then it'll hit you with, so you might as well.
Mm.
You're such a loser, you're never going to figure this out anyway. There's something wrong with you. So you might as well use the porn. Right.
Yeah.
So, but without that education, it's like it'll get you with self deprecation. And where we teach the guys right from the start, you start the self deprecation. That's the addictive part of the mind. Go directly to your script.
Yeah.
So, yeah, I don't want to say complex, but it's in depth. It requires in depth
Mm.
education. And you can absolutely get beyond porn addiction.
Yeah.
Absolutely, 100%. But
Yeah.
not by purchasing blockers, the latest app for blocking your whatever, or doing push-ups or,
Yeah.
identifying red frogs, whatever the hell,
Yeah.
So,
I don't
yeah.
really get how people are even allowed to like say those things when it's just like goes against all the evidence and the data, like and the research. But as I say, I'm not a doctor, but I've read a lot of like research and studies and
Yeah.
stuff, and it's just like this stuff just fully goes against it. But there we are.
Well,
Maybe
it's
things will
like
change.
I told our client last night.
Mm,
Have an addiction epidemic. And so then all these professionals that are in any way related to wellness, if you're
mm,
a urologist, whatever, doctor, or you're a physical trainer, or you're a personal trainer, whatever,
mm,
nutritionist, all this kind of crap is like we have this epidemic of people feeling unwell. They're unwell because of their addictions, not just because they're innately unwell. But so we also have this epidemic of wellness coaches, right? Just throwing whatever shit they have at it
mm.
with no understanding of the actual problem.
Yeah,
So yeah, it's a thing. I hate
big
that
time.
expression, but it is a thing.
It
So
is a thing.
it's a
Right.
thing.
Yeah,
Yeah.
yeah, it is. All right. Well, I hope this has been useful, this podcast in one way or another. We're gonna have way more podcasts coming throughout 2025. Hopefully we can provide some hope as help is certainly here. And if
Hope
you
is
do
here.
want to learn a little bit more about the Beyond Compulsion method, I'll drop a link in the description to some free training. Give that a watch, see what you think. Thanks again, and we'll see you in the next one. Bye bye.